Today we are going to talk about neck disorders. As you can see here, what I'm having a spine model. Particularly, we are going to focus on the cervical spine. So when I say the cervical spine, I'm referring to the human neck. And the human neck is composed of 7 different bones, very small bones. We usually count them from the base of the skull. So this small segment here, this is the base of the skull. And then we have C1, C2, C3, C4, C5, C6, and then C7. So basically that is the human neck, what we are calling the cervical spine. On this cervical spine, you see that we've got the nerve roots on each and every segment coming from the spinal cord. From right in there, we have the nerve roots. And they are on both sides, so we say that they are bilateral on each side, that is both the left and the right side. So what usually happens, you find that these nerve roots, they supply each and every upper limb. For example, the ones on the right side, they supply the right upper limb, or the right hand, the right forearm, and the right arm, plus even the shoulder. So there are some people who get compression of these nerve roots at different levels, and the compression can be caused by anything, including a bone. There's a bone, these are different bones, these are discs, so the discs can also cause some form of compression to the nerve roots. There could be a tumor, there could be anything, even a joint dysfunction that could be causing some compression on the nerve. For this particular case, a patient will come in complaining of abnormal sensation on the upper limbs, or on one upper limb if it is the right side that is affected. If it's the left side that is affected, then the person will be talking or complaining of issues to do with numbness, tingling, pins and needles, or even weakness or incoordination on the left side. If the compression is right at the center of the spine, what is likely to happen, the symptoms will be bilateral. This is to mean they'll be on both sides. So basically, this is the introduction of a human neck. Going to discuss further about the management of nerve root compression on the cervical spine, or management of cervical traction machine. Has different segments. So this is the shoulder segment, where the patient's shoulders are going to be, and this is the neck segment. So the neck is going to be in between here, and then the base of the skull should be resting comfortably here. Ideally, this is a pneumatic cervical traction machine. So this is to say the machine uses the principle of air. So basically, I use this pump according to the patient's body weight, and then I do the pumping. So as you can see, the machine is moving up as the gauge is also rising up. Hold for at least 10 minutes. And the compression on the nerve roots will be eased. I'm going to apply the upper harness over here. I fit it comfortably, tightening the neck segment that is going to hold the base of the skull, so that the moment I start pulling or I start pumping, the head will go up slightly as the rest of the body stays stationary. So after sustaining this position of traction for about 10 minutes or more, then it is time to release, just a gentle release. Sometimes I do it in bits. I may release and then hold it a little bit, release and hold, or just continuous depending on this patient's symptoms or how she's feeling. Again, you also see the neck is going back to its position after the pull. So that is why I said that we need to be able to maintain those good benefits of traction, doing a therapeutic exercise after this. This mechanical traction was not effective. If it was painful or if it increased her symptoms, what I would do, I would have to do a manual technique to be able to release the compression. Breathe in deeply, take it out, given a very gentle pull, a very gentle traction. It has to be done in short bursts. Hold it for about a minute or so. The manual technique is more relaxing.